Hello friends, I am Dr. Mohammad Mukarram Ali, Consultant Pulmonologist, Pratima Group of Hospitals, Kachiguda. Today I am going to talk few lines about the airway disorders and what are the types of airway disorders. Airway disorders means your airways function in your body, they circulate the oxygen levels. So sometimes there is a disease called asthma, which you all know, and there is a disease called COPD, and there is a disease called asthma COPD overlap syndrome. Airway disorders usually are classified into these three categories. And now what happens in asthma is like there is a airway obstruction and there is a lot of secretions into the airways, which causes continuous breathlessness, cough, and sometimes you have infections into that airways and they cause fevers also. It can be a viral infection, it can be a bacterial infection also. So asthma patients have progressive breathlessness, they usually have chest tightness, and more in the winter seasons and more during the time of pollens and all. And they have a lot of when they expose themselves to dust, allergens and perfumes and other places, so they have bronchoconstriction, the airways get constricted, and there is a limitation of the airways, and which causes breathlessness for their daily activities. So we have to identify asthma depending on the pulmonary function test, sputum levels, CBP levels, and the chest x-ray and the history as well. So with this, we have to confirm the diagnosis of asthma and we have to treat the patient accordingly with good inhalers or nebulizations if the patient is a pediatric patient or a very elderly patient. And there are a lot of new devices which can be used for the control of asthma, including oral tablet medicines as well. And we can use high-end medicines which are nowadays available, like biologicals, which are injectable forms which are given once in 15 days, once in 1 month, who have a refractory asthma, who have a difficult to treat asthma. So the advances are there in the field and we are ready to treat the patients accordingly. And first of all, we have to identify what is the cause of asthma. The next disorder is the chronic obstructive pulmonary disease. Usually this disease is of the airways. Again, people who usually smoke more than 20 years and who have a occupational exposure of more than 20 years, patients working in mines, in the places where there is a lot of dust, fumes, coal mines. So these patients usually have to get themselves evaluated with a chest x-ray, pulmonary function test, CBP and sputum levels, and see how is the progression of their airway disease. If the airways are reversible, then and if the lung function is maintained, then they don't have to worry. If the airway is not reversible, what we see usually on a PFT is the reversibility of the airway. If the airways become stiff and hard, then the diagnosis of COPD is confirmed. Then you have to identify your root cause, you have to eliminate the root, what has caused this disease, and you have to treat accordingly with the medicines appropriately. And we can use medicines which can be beneficial, and the role of pulmonary rehabilitation also comes here. What happens is you educate the patient how to do exercises, breathing exercises and other measures to keep your lungs intact and healthy. And the third thing is asthma COPD overlap syndrome. The patients now present who have previous symptoms of asthma, who are not treated on time, and they develop patients of breathlessness, symptoms of breathlessness, which are not relieved by taking regular inhalers. So now the patient has a stiff airways, the airways becomes more fixed and stiff. So the treatment has to be given according to the COPD and asthma guidelines, that is called ACOS syndrome. So the treatment can be done accordingly. I request all of you to get yourself evaluated, get yourself treated as early as possible. If you have either of the symptoms of cough, SOB, breathlessness, chest tightness, and who have exposure of smoke and other occupational hazards, including the people who are working outdoors. Thank you so much. Have a nice day.